Dr. Therian here, going to talk to you a little bit about the Miboflow. So we've got Tony with us, and we've got Claire over here with us. And Tony's going to be our little guinea pig. You've done this a couple of times now, right, Tony?
Yes, twice.
And so a couple of times. And Claire, you've done this. How many times have you done one of these treatments? Once or twice? A lot. Fair enough. So we're going to get going on this. But basically, this is the Miboflow, and this is kind of how it works. But it takes about 10 minutes is how long we do each eye. Claire's got a little bit of ultrasonic gel there on her glove. And that little device, the instrument there, gets pretty daggone hot. And we just rock and roll it on the eyelid there, as you can kind of see. And so I'm going to come around to the other side. I think I'll get a better view. And so this is this your third time, Tony? Or?
Yes.
Okay. And what was the reason that brought you in? Talk to me about that.
My eyes were red, itchy. It felt like I had insulation on the top of my eyelids. They were hurting and so dry, it was miserable.
Right. And how did it feel after the first treatment?
A world of difference.
Okay. How long did that last?
About a week.
About a week? Okay. And then you had the second treatment, and how long did that one last feeling good?
About 2 weeks.
Okay. And so after this third one, normally we get about 3 months worth of comfort and all that stuff out of it. It's not a one and done type treatment. We go about 3 months in between each one after you get this third treatment. And so hopefully we're getting that kind of distance out of it. And the gel that Claire used was perfectly clear. And so as we move along, you can kind of see, and I'll zoom in. Yeah, there you go. You can see it's getting a little bit of color to it. Not quite so clear, but how does it feel, Tony?
It feels cooler, not so irritated. It feels like it has more moisture into my eyelid.
Okay.
And I don't have that burning, and I feel like I have insulation type irritation on my eyelids.
Okay.
But it's relieving it.
Okay. Does it ever hurt whenever we're doing this?
No.
No? Never really stings or anything like that?
No. Just after the procedure, my eyes are a little tender because of the pressure, but it's not uncomfortable.
Okay. Now, does it feel really good when she goes in any specific area, or does it feel about the same everywhere?
It feels really good when you do the upper part of my eyelid.
So when she goes up there like
yes.
that?
That's where more of the irritation and the rough skin and the redness, and it's a little bit swollen.
Okay.
And it makes your skin, I've noticed from the beginning that makes, when the eyes are very irritated, that your skin is like more droopy over your eyelid.
Okay.
But after the treatment, it tightens it up and it's not as loose and droopy.
Yeah, it makes the eyelid feel a little bit lighter too.
Correct.
Yeah, that's the thing that I always notice is it's like it feels like it feels like it's supposed to when you blink. It's kind of weird. But yeah, and so Claire just kind of works it back and forth like that. Where she's at right now in your eye is where it feels the best on me. I like it more when it's real close to my nose area, over in there. I know.
It feels good in the corner. And I've noticed with the dry eyes or allergies in the corner of each eye, that feels amazing right there because it gets really itchy.
Yeah. And so makes quite a bit of difference.
It makes a world of difference.
For sure. Yeah.
And at first I thought, oh, it's just my allergies, or I said, well, do I have a bacterial infection? Or I didn't know but is it really caused to allergies and dry eyes together?
Yeah, so you can't have allergies without dry eye. They kind of go hand in hand.
Okay.
You can't have dry eye without allergies because allergies are inflammation that you're not supposed to have. And dry eye, if you have dry tissue rubbing against dry tissue, you're going to have inflammation in that area.
So that's what it is.
And so, yeah, they go hand in hand, and that's where it gets kind of tricky. A lot of people will ask or think that the number one cause of itchiness is allergies, but actually the number one cause of itchy eyes is dry eye related.
Okay.
And so usually if we can fix the dry eye, we can fix the allergy problems. And so it makes a big difference because most people think it's allergies when it's really just dry eye. And especially in Oklahoma where we have tons of wind, tons of dust. It just really messes with us.
Now, ask you a question about the reports are higher right now than it has been with dry eyes? Are more people complaining about it?
So during springtime, it's always worse because our wind kicks up a whole bunch.
Right.
And we don't know if the heaters are supposed to be on or if it's going to rain for 3 days straight or if it's not going to rain for a month. And so just like our skin gets dry during certain times of the year, our eyes get dry during those times as well. And so it's usually a big spike up in dry eyes during springtime and then a big spike up during winter whenever we have no humidity at all. The other thing that kind of messes with us, and I actually just did a video about it, is that we have an increase in styes going on right now. And so what happens is styes are basically plugged up oil glands, which this is clearing out those plugged up oil glands.
Okay.
But the reason we end up with a lot of styes right now is because if there are allergens out in the world, our eyes itch.
Right.
If our eyes itch, we want to touch our eyes with dirty hands.
Correct.
And when we touch our eyes with dirty hands, that's the number one cause of a stye. And so if we're rubbing our eyes a bunch because of allergy season, we're plugging up a bunch of oil glands. And lo and behold, if those oil glands are plugged up, they can't do their job like they're supposed to. And lo and behold, we end up with a whole heck of a lot of dry eye stuff.
That makes so much sense.
Yeah.
Now, is there like a cream that I need to use like in between treatments, you know?
No.
Just what is safe for me to clean my eyes with when I take my makeup off?
So the makeup remover is good. You just want to make sure you get all of your makeup off.
Right.
And if you can, try not to use an oil-based makeup remover. Because what'll tend to happen with the oil-based makeup removers...
I have Clinique oil-based remover that I pay a lot of money for that stuff, so I'm giving it away.
Yeah. But the oil-based makeup remover tends to clog these oil glands because that's where problems can kind of run into. And that's where styes typically only last about a week or so.
Okay.
And then they're gone on their own. And so a lot of people will have a small grade 1 or a low grade 1 and not think anything of it or not notice anything. But if they start having them on a regular basis, then we end up with big problems. And current research says that if we have glands plugged up and clogged up for long enough, they'll die off and we won't ever get them back. And so what ends up happening is we end up with a situation where someone that's been dealing with mild dry eye in their 30s and 40s and 50s becomes major dry eye in their 60s and 70s, and we can't do really anything about it because current theory says once dead, always dead. And so things like this flushes those glands out, keeps them alive, keeps them acting a little bit more, and helps keep things happy and moving so that when we are in our 60s and 70s, we don't end up with any problems. That's like I've got one patient right now that we have literally brought her in twice a week for 2 weeks, and now we're doing every week for about 3 or 4 weeks because she has no oil glands. They've been clogged up and backed up for about 20 years probably.
Oh my gosh.
And so I'm just trying to find one oil gland that can function and do its job so that they can try to keep her happy.
Oh, bless her heart.
Yeah, it's pretty bad. And it's one of those deals that, you know, we did the first treatment on her. She said it felt great for about an hour, maybe 2, and then it was back to where it was before. But she literally has to, in the middle of the night, when she goes to get up, she has to like sit there and forcibly open her eye with her hands because it's just stuck down dry so bad. Man. And so I'm really hopeful that as we move along with her, that eventually I get her to the level where you're at and it's feeling really good for 3 months with it. And then I can bring her in and talk to her about all this stuff.
She'd be a great candidate.
Yeah, and so it's just a matter of how long is it going to take for us to get there kind of deal. And so, yeah. And so you can see quite a bit of difference there. Yeah, in color. So now I'm going to speed the video up just a little bit to help get through that whole 10 minutes on the left eye treatment. But you can see Claire continues to work the Miboflow treatment there on her left eye for the full 10 minutes, and there's no pain, none of that kind of stuff going on. And then at the end of the 10 minutes, we we'll check and see kind of where the color difference looks like on all of it. And you'll be able to see quite a bit of color difference between that clear gel that we were originally starting with and the cloudiness and color there at the edge of her eye. So thanks for watching.